Hey everyone, it's me, Miss Ruiz, and I'd like to thank you for joining me as we discuss Chapter 13, Coding Digestive System Conditions. Let's get started. Learning Outcomes. After completing this chapter, you should be able to analyze the documentation for applicable details needed to report diseases affecting the mouth and salivary glands accurately. You should be able to interpret documentation to determine necessary details to report conditions affecting the esophagus and the stomach correctly. You should be able to apply your knowledge to identify main terms relating to intestinal disorders. Evaluate the specifics from the documentation related to digestive accessory organs and malabsorption disorders accurately. And finally, determine the additional codes that are required to report the involvement of alcohol. Key terms for this chapter include accessory organs, anus, ascending colon, cecum, cholelithiasis, common bile duct, descending colon, duodenum, edentulism, esophagus, fundus, gallbladder, gangrene, hemorrhage, hernia, ileum, jejunum, liver, mesentery, obstruction, oral cavity, pancreas, pancreatic islets, perforation, rectum, salivary glands, sigmoid colon, sphincter, stomach, teeth, transverse colon, and vermiform appendix. 13.1 Diseases of the oral cavity and salivary glands. Oral cavity includes the lips, cheeks, tongue, lingual tonsils, hard and soft palates, uvula, palatine tonsils, pharyngeal tonsils, and teeth. Edentulism, also known as tooth loss, has 4 classes. Class 1 is the stage of edentulism with the best prognosis for successful treatment using conventional techniques. Class 2 is deterioration of the gums and other supporting structures along with systemic disease interactions, soft tissue concerns, as well as patient management and/or lifestyle considerations affecting the prognosis of the treatment. Class 3 is the existence of other factors affecting the outcomes of treatment, plus the need for surgical revision of the supporting structures such as the gums and bones to enable prosthodontics. Class 4, a severely compromised condition of supporting structures requiring surgical reconstruction. A customized prosthodontic technique may need to be created for an acceptable outcome. Salivary glands. 3 sets of bilateral exocrine glands that secrete saliva. The parotid glands, submaxillary glands, and the sublingual glands. Coelodentitis, also known as parotitis, is an infection of the parotid glands. Code examples include K11.21, acute coelodentitis, K11.22, acute recurrent coelodentitis, and K11.23, chronic coelodentitis. 13.2 Conditions of the esophagus and the stomach. Gastroesophageal reflux disease, also known as GERD. GERD may be caused by a slacking lower esophageal sphincter, which separates the stomach from the esophagus and is designed to prevent backflow from the stomach upward. Code examples include K21.0, gastroesophageal reflux disease with esophagitis, and G21.9, esophageal reflux disease without esophagitis. Stomach. A sac-like organ within the alimentary canal designed to contain nourishment during the initial phase of the digestive process. Examples include K31.1, adult hypertrophic pyloric stenosis, and K31.3, pylorospasm not elsewhere classified. Ulcers are a sore or hole in the tissue. Examples in the digestive system include ulcer of esophagus, gastric ulcer, which is in the lining of the stomach, duodenal ulcer, gastrojejunal ulcers. Further description of these ulcers may include known complications resulting from an ulcer in this segment of the upper digestive system, such as perforation and hemorrhage. Hernias. A condition that results when a tear or opening in a muscle permits a part of the internal organ to push through. Types of hernias. Hiatal or esophageal hernias. A portion of the stomach pokes through an opening in the diaphragm. Umbilical hernia. A muscle near the navel, also known as the belly button, does not close completely and the internal organ protrudes. Incisional hernia. is a defect at the site of a previous abdominal surgical opening and usually includes some scar tissue. Inguinal hernias are in the groin area, and femoral hernias are in the upper thigh. 13.3 Conditions affecting the intestines. Small intestine examples include K28.0, acute gastrojejunal ulcer with hemorrhage, K28.2, acute gastrojejunal ulcer with both hemorrhage and perforation, K29.80, duodenitis without bleeding, K31.5, obstruction of duodenum, and K50.00, Crohn's disease of the small intestine without complications. Large intestine. You may notice that the two terms colon and large intestine are used almost interchangeably. In reality, they are technically not the same thing. The large intestine consists of the cecum, the vermiform appendix, the colon, which is the majority of the large intestine, the rectum, and the anus. The colon consists of ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid colon, rectum, and anus. Ulcerative colitis is an inflammation of the lining of the colon. Code examples for this include K51.0, ulcerative chronic pancolitis, K51.2, ulcerative chronic proctitis, K51.3, ulcerative chronic rectosigmoiditis, K51.4, inflammatory polyps of colon, K51.5, left-sided colitis, and 51.8, other ulcerative colitis. Diverticular disease of the intestine. Diverticulosis is a condition where there are small pouches that develop and protrude outward through the intestine. Diverticulitis is when these pouches become inflamed or infected. While abstracting the documentation, you will also need to determine, is the small intestine, large intestine, or both affected? Is there a mention of perforation, abscess, or bleeding? These questions will aid you in making sure that you are coding to the greatest level of specificity. 13.4 Dysfunction of the digestive accessory organs and malabsorption. Gallbladder, a sac that functions as a storage tank for bile. A yellow-green liquid created by the liver and used by the body to assist in the digestive process. Coding examples include K81.0, acute cholecystitis, K81.1, chronic cholecystitis, and K82.3, fistula of the gallbladder. Pancreas, a gland that secretes insulin and other hormones from the islet cells into the bloodstream and manufactures digestive enzymes that are secreted into the duodenum. Example codes include K85.0, idiopathic acute pancreatitis, K85.1, biliary acute pancreatitis, K85.2, alcohol-induced acute pancreatitis, and K86.0, alcohol-induced chronic pancreatitis. Liver. Liver is the organ that is located in the upper right area of the abdominal cavity. This is responsible for regulating blood sugar levels, secreting bile for the gallbladder, metabolizing fats, proteins, and carbohydrates, manufacturing some blood proteins, and removing toxins from the blood. Example codes include B18.2, chronic viral hepatitis C, K70.10, alcoholic hepatitis without ascites, K74.3, primary biliary cirrhosis, K74.69, other cirrhosis of the liver, and finally K76.4, paleosis hepatitis. Celiac disease. Celiac disease is the recurrent attacks of diarrhea, abdominal distension due to flatulence, stomach cramps, and weakness are some of the most frequently experienced signs and symptoms. Celiac disease may be the underlying cause of multiple ulcers forming within the lining of the small intestine. Code example K90.0, celiac disease. Note that there is a use additional code for associated disorders including dermatitis herpetiformis L13.0, gluten ataxia G32.81. There's also a code also exocrine pancreatic insufficiency K86.81. Remember, your documentation does have to include this in order for you to use those codes. 13.5 Reporting the involvement of alcohol in the digestive disorders. Alcohol abuse affecting digestive system. When abstracting for digestive system disorders, be aware of these diagnoses that are known to be connected to alcohol abuse. These include mouth cancer and gum disease. Alcohol abuse can increase the risk. GERD and gastritis, excessive use of alcohol, can damage the sphincter between the esophagus and the stomach, permitting stomach acids to backwash into the esophagus. Malabsorption and malnutrition, consistent with excessive intake of alcohol, can interfere with the absorption of nutrients. Pancreatitis. Alcohol abuse can cause inflammation in the pancreas and interfere with the function of the digestion. Alcoholic liver disease. Alcohol abuse can cause this, a precursor to cirrhosis. Chapter summary. The organs included in the digestive system run from the head to the bottom of the torso. Therefore, several different healthcare specialists may be involved in caring for patients with digestive disorders, depending upon where the abnormality is located. Healthcare issues within the digestive system can occur as a result of a congenital anomaly, traumatic event, or dietary influence. This means that there may be times when the external cause code is required to be included so that you can tell the whole story about the reasons why, which is the medical necessity, that this patient was cared for. That's all I have for you today. Thank you everybody for joining me, and I will see you next time. Have a good day. Bye.